Most women with endometriosis probably don't have any problems falling pregnant. Now, that information is a little bit hard to come by because in the clinics where women are seen for fertility, endometriosis is in fact a very common problem. But most women with endometriosis probably don't have any problems falling pregnant.
Endometriosis is a progressive disease. Women who have had endometriosis diagnosed by imaging should seek expert help to discuss the benefits of having their endometriosis removed to enhance their future fertility.
One of the things that we often get asked is if you are asymptomatic, you don't have any pelvic pain, but you've got some suggestion of having a disease such as deep pelvic disease that's been identified on a scan or may be able to be felt at the time of examination, or disease in the ovary, should we remove this disease so that your future fertility is guaranteed? Now, there's no evidence whatsoever to suggest that prophylactic removal will improve fertility in the future. And in fact, surgery may actually impair fertility. We need to remember that not all women who have endometriosis will have problems becoming pregnant in the first place, and really the only test is to try to become pregnant initially. If you're successful, then that's a great thing, and you obviously don't have any of those issues, and you're in the 2 out of 3 women that don't have any problems with becoming pregnant. But to remove disease where you don't have a problem is not something that we would recommend. We often talk about different types of endometriosis: superficial disease, deep disease that starts to invade into the tissues, and ovarian disease. And we classify these almost as separate types of endometriosis. And in fact, this may be true, although we don't yet have all of the information and the knowledge to be able to absolutely categorize according to that classification. However, we do know that for women who have very severe disease, they often have more troubles in becoming pregnant. We also know that for women who have disease that affects their ovaries primarily, that can affect both egg quality and the chances of them becoming pregnant, even if they have IVF or surgery. We have some ways of assessing the total number of eggs you have. That's not a reflection of quality, but simply of quantity, and that can be a factor as well. That might help us guide which treatment is best for you.
Endometriosis is classified into 4 groups, from minimal to severe. The worst 2 groups are moderate to severe endometriosis, and women with moderate to severe endometriosis will have more difficulties falling pregnant than women who have minimal to mild endometriosis.
When it comes to falling pregnant in women with endometriosis, some women will experience problems. In that situation, the type of treatment depends on the exact scenario. It may be as simple as lifestyle changes, or you may require more advanced treatment such as IVF.
It's important to remember that if you have endometriosis, there's actually a very good chance you won't have any problems with your fertility. In fact, we know that about 2/3 of women who have endometriosis have no problems in conceiving. So it's only around about 1 in 3 women that may face some issues and need to proceed to other routes of assistance like IVF or like surgery.
Most women with endometriosis will fall pregnant spontaneously without medical intervention. Women with endometriosis who have been trying to fall pregnant for more than 6 months should seek expert help.
For women who are having trouble becoming pregnant and don't become pregnant naturally, the question is which one to choose first. Do you have surgery or do you have IVF? And there's no scientific studies to show one is absolutely better than the other. And therefore, the decision will usually come down to the woman making a choice as to which one she would prefer to do or not prefer to do. And certainly in my experience, many women will have a preference one way or the other. For women who do have difficulty and have lesions and pain, it may be a reasonable option to have a surgery with removal of disease so that they get both a reduction in their pain symptoms and also an improvement in fertility. For women who don't have pain, it's a perfectly reasonable and probably first-line option for them to consider IVF as a treatment option to help them to become pregnant first. But again, it's not an absolute. You do need to discuss these with your doctor, and particularly individual circumstances may change.
We have good evidence from a number of studies now to show that the recurrence of endometriosis is not increased in women having IVF. So if you need IVF, you can have that intervention without any concern that your endo might come back.
We often talk about women who require IVF to help them in becoming pregnant, and whether the dose of drugs and the high levels of estrogen will cause a recurrence. There's a couple of different factors here that we need to take into consideration. The first one is that if you have had endometriosis removed, then there's about a 50% chance, between 30 and 50% chance, that your endometriosis is going to come back anyway, regardless of whether you've had any interventions such as IVF. However, the process of IVF also involves the ovaries being stimulated and producing very high levels of estrogen, and we know that that can also drive disease. Nearly all of the studies that we've had suggest that there isn't an increased risk of recurrence of endometriosis in women who have IVF.
The majority of women with endometriosis will have normal pregnancy outcomes.
Our knowledge of the impact of endometriosis on a pregnancy has actually changed quite substantially in the last 20 years. We now understand that there are certain risk factors for a pregnancy in women who have had endometriosis. We know that there's a slightly increased risk of miscarriage in women. It's not a dramatic risk, but it is around about 3 or 4%. Sadly, there's nothing we can do about that increased risk. And it's probably because the lining of the uterus in women who have endometriosis is not the same as women who don't have endometriosis, and that may lead to that increased risk. Again, we don't have hard and fast science on that. The second area that may cause problems with pregnancy is an increased risk of a variety of problems throughout the course of pregnancy, and that includes an increase in the chance of getting hypertension associated with pregnancy, what we call preeclampsia, and that can lead to problems in the mother and or the baby and needs to be carefully examined and assessed for. We know that women do tend to deliver a little bit earlier if they have endometriosis, generally around 37 weeks. That generally isn't a big problem for most women or babies who have that slightly earlier delivery. And the third area in pregnancy is an increased risk of what we call placenta previa, or a low-lying placenta. And that would require a caesarean delivery because a woman can't labour if she has a placenta previa.
The myth of pregnancy curing endometriosis is just that. It's a myth. There is no credible evidence to suggest that in fact the endometriosis will be changed in any way by pregnancy. Now, because you will not be having any periods in this over that time, you will not be experiencing any pain related to periods, but it will not alter the course of the disease.
Perhaps one of the greatest myths of endometriosis is that pregnancy is curative. And I think it's a really important thing for us to recognise that having a baby is not a prescription, it's not a treatment for endometriosis. It's a really important thing for us to recommend that women have a baby when they want it, and not because we think it's going to improve their symptoms, for example, pain symptoms. So we don't think of pregnancy as a treatment nor of a cure of endometriosis. And for women who have substantial disease in their ovaries or deeply invasive disease where they have been pregnant, there's a lot of scar tissue and the development of a lot of muscle in the pelvis. That's not going to go away because of the pregnancy and is very easy to recur, and they often get their symptoms back because of those problems after the baby is born.
In women with endometriosis, like all women, the best time to have a baby depends on when you are ready to have a family. It is not affected by what your disease is doing or how your endo is progressing.
One of the things that women with endometriosis need to consider is when they are going to have their family. If you do want to have family, actually the single biggest factor is age. We know that for women who are trying for a family, less than 30 is still the best time to become pregnant because of egg age. Between the ages of 30 and 35, fertility is declining slowly, but certainly declining. Between 35 and 40, fertility declines quite rapidly, and then after 40 it declines extremely rapidly, such as by the age of 44, the chances of pregnancy are quite low, and that's either expectantly or with IVF. And so therefore, women who have endometriosis may choose to have their babies slightly earlier. But again, there's a lot of factors involved in this. So social circumstances often play a big role in the timing of pregnancy for women who have endometriosis, as they do for anyone.
Women with endometriosis, and in particular ovarian endometriomas, should discuss the benefits of egg freezing with their endometriosis expert.
For women who have endometriosis, frequently they ask, should I freeze my eggs? And I think that there's a number of factors involved here. What I usually tell women is, don't worry up until the age of 30, because we really don't have any hard and fast evidence that it makes any difference, and the process is quite invasive. Between 30 and 35, start thinking about it, but if you're going to make that decision, then it needs to really be before 35 to have the best chance of a good outcome for you. Between 35 and 40, you can freeze eggs, but it dramatically decreases the chance of successful conception if you choose to unfreeze those eggs to make a baby in the future. We need to remember that underlying this, not all women will have a problem with fertility anyway who have endometriosis. For women who have disease in their ovaries, there may be special circumstances where it is appropriate to freeze eggs and freeze them early. And that's a very special consideration for that group of women. It's not a large group of women where we think about only 20% of women will have disease that affects their ovaries, but it is an important consideration, and you do need to talk to your doctor about that if you're going to have surgery on your ovaries.